Imagine this for a moment. You're sitting quietly at home, the TV is on, the phone is in the other room. Suddenly, your arm feels weak, your words don't come out right. You're alone, and every second now decides your future. A brain stroke does not knock politely. It arrives suddenly, and after 60, it can be deadly if you don't know what to do. But remember this, even if you are alone. You can survive a stroke if you act fast and smart. 1. Recognize the warning signs early. Fast rule. Recognizing the warning signs of a brain stroke early can be the single most important factor that decides life, death, or lifelong disability, especially after the age of 60. A stroke rarely gives a long warning. It strikes suddenly, often when a person is alone, relaxed, or least expecting it. That is why every senior must remember one simple word: fast. Fast is not just a medical term. It is a survival tool. The letter F stands for face. During a stroke, the muscles on one side of the face may suddenly weaken. A smile may look uneven, or one side of the face may droop without pain. If you feel numbness, heaviness, or an inability to control facial muscles, your body is sending a serious warning. The letter A stands for arm. A stroke often causes weakness or numbness in one arm or leg, usually on one side of the body. You may find that you cannot lift your arm, hold an object, or maintain balance. Even a mild weakness should never be ignored. The letter S stands for speech. Speech problems are one of the clearest signs of a stroke. Words may come out slurred, confused, or not at all. You might know what you want to say, but your mouth cannot form the words properly. If your speech suddenly changes, it is a medical emergency. The final letter, T, stands for time. Time is critical. Every minute a stroke goes untreated, millions of brain cells are lost, waiting, hoping it will pass, or trying to rest can lead to permanent damage or death. Remember, strokes are often painless, which makes them even more dangerous. Do not wait for pain. Do not doubt yourself. If any fast symptom appears, act immediately. Knowing these signs and trusting them can save your life when no one else is around. To call emergency services. Immediate telecalling emergency services immediately during a suspected brain stroke is one of the most powerful actions a senior can take, especially when alone. Many people make the dangerous mistake of waiting, hoping the symptoms will disappear on their own. After 60, this delay can be fatal. A stroke is not something that improves with rest or time. In fact, time is the enemy. The longer the brain is deprived of oxygen, the more brain cells die, leading to paralysis, loss of speech, memory damage, or death. If you feel sudden weakness, slurred speech, confusion, dizziness, or facial drooping, do not try to be brave or dismiss it as fatigue. Even if you are unsure whether it is truly a stroke, it is always safer to call for help. Emergency responders are trained to assess the situation quickly and begin life-saving treatment on the way to the hospital. Modern stroke treatments work best when given within the first few hours, and calling immediately can mean the difference between recovery and lifelong disability. Do not waste time calling friends or family first. Loved ones may take time to arrive, but emergency services can reach you faster and bring proper medical equipment. If you are struggling to speak, try dialing the number anyway. Many emergency operators can trace the call and send help even if you cannot explain clearly. If possible, put your phone on speaker so you can breathe and stay calm while help is dispatched. Fear often causes hesitation. But remember this, a stroke is a medical emergency, not an inconvenience. You are not bothering anyone by calling. You are protecting your life. Acting fast shows strength, not weakness, when a stroke strikes. The smartest and bravest decision is simple: call emergency services immediately and let professionals save Your life. 3. Unlock the door for rescuers. Unlocking the door for rescuers during a suspected brain stroke may seem like a small detail, but it can make a life-saving difference, especially if you are alone when a stroke occurs. Every minute matters. Emergency responders often lose precious time trying to enter a locked home, breaking doors, or searching for alternative access. Those few lost minutes can mean more brain damage, reduced chances of recovery, or even death if you have already called emergency services and are physically able. Try to unlock your main door as soon as possible, even if your movements are slow or weak. Making the effort can greatly speed up the rescue process. If there is a gate, security lock, or chain, unlock that as well. This simple action allows paramedics to reach you immediately without delay. Many seniors underestimate how quickly stroke symptoms can worsen. You may feel able to move at first, but weakness, confusion, or loss of consciousness can follow suddenly. Unlocking the door early ensures that if your condition deteriorates, help can still reach you without obstacles. If you live in an apartment, try to unlock the door and, if possible, inform security or a neighbor that emergency help is coming. If walking becomes difficult, unlock the door and then sit or lie down safely near where you are. Do not exhaust yourself by trying to do too much. Just opening the door is enough. Even placing keys near the door or shouting to alert neighbors, if you can, may help. Preparing in advance also matters. Seniors should keep doors easy to unlock, avoid complicated locks, and consider leaving spare keys with trusted neighbors. In a stroke emergency, unlock doors save time, and save time saves lives. Sit or lie down in a safe position. Sitting or lying down in a safe position during a suspected brain stroke is extremely important, especially when you are alone and help is on the way. Many seniors make the mistake of trying to walk, stand, or push through the weakness, which can lead to dangerous falls, head injuries, or worsening brain damage. A stroke affects balance, coordination, and muscle control. Even if it feels mild at first, trying to move around can cause sudden collapse without warning. As soon as you recognize stroke symptoms, gently sit down if you are standing. If possible, lower yourself slowly to avoid dizziness. The safest position is to lie down on your side with your head slightly raised. This side-lying position helps keep your airway clear and reduces the risk of choking, especially if nausea or vomiting occurs. If lying down is not possible, sit in a stable chair with back support and keep both feet flat on the ground. Avoid lying flat on your back, as this can increase the risk of choking if vomiting happens or saliva builds up. Do not use pillows to prop your head too high, as this may strain your neck or affect breathing. The goal is comfort, safety, and stability, not movement. Staying still also helps conserve energy. A stroke puts severe stress on the brain, and unnecessary movement increases oxygen demand. Remaining calm and still allows your body to cope better until medical help arrives. Focus on slow, deep breathing to keep oxygen flowing to your brain. If you feel cold, cover yourself lightly, but avoid heavy blankets that may restrict movement or breathing. Keep your phone nearby in case emergency services need to contact you again. Most importantly, resist the urge to walk to another room or open windows unless absolutely necessary. Remember, during a stroke, less movement means less risk. Sitting or lying down safely protects you from injury and gives emergency responders the best chance to help you quickly and effectively when arrive. 5. Do not eat, drink, or take medication during a suspected brain stroke. It is extremely important not to eat, drink, or take any medication, even if you feel thirsty, hungry, or think a pill might help. Many seniors make this mistake out of habit or panic, but it can be very dangerous. A stroke often affects the muscles and nerves that control swallowing, even if swallowing feels normal at first. It can suddenly fail without warning. When swallowing is impaired, food or liquid can easily enter the airway instead of the stomach. This can cause choking or lead to aspiration. Where food or water goes into the lungs, aspiration can result in severe breathing problems, pneumonia, or even sudden death. Water, which seems harmless, can be just as dangerous as solid food during a stroke. Taking medication is also risky. Pills may get stuck in the throat or be inhaled into the lungs. In addition, some medications such as blood thinners, painkillers, or blood pressure drugs can worsen bleeding in certain types of strokes. Without knowing whether the stroke is caused by a blood clot or bleeding in the brain, taking any medicine on your own can do more harm than good. Dry mouth is common during a stroke. But do not try to relieve it by sipping water. Instead, focus on slow, calm breathing through your nose. If saliva builds up, gently turn your head to the side and allow it to drain out naturally. This helps prevent choking without the need to swallow. It is also important not to drink alcohol or herbal remedies, no matter what you may have heard. These do not treat strokes and can delay proper medical care. Emergency doctors need a clear understanding of your condition. And consuming substances beforehand can complicate diagnosis and treatment. The safest choice is simple: do nothing by mouth until medical professionals arrive. Let trained responders decide when it is safe to eat, drink, or take medication. In a stroke emergency, resisting this natural urge can protect your airway, prevent complications, and increase your chances of survival and recovery. 6. Stay calm and control your breathing. Staying calm and controlling your breathing during a suspected brain stroke can significantly improve your chances of survival, especially when you are alone and waiting for help. Fear is a natural reaction, but panic can make the situation worse. When panic sets in, blood pressure rises, the heart beats faster, and the brain becomes more stressed at a time when it already lacks oxygen. This added strain can increase brain damage and worsen symptoms. As soon as you recognize something is wrong, consciously tell yourself to stay calm. Remind yourself that help is on the way and that many people survive strokes because they act wisely. Focus your attention on your breathing. Take slow, deep breaths in through your nose and gently out through your mouth. Try to breathe slowly and evenly. This helps deliver oxygen to the brain and prevents dizziness or fainting. Avoid rapid or shallow breathing, which can increase anxiety and make you feel weaker. If your speech is affected, do not force yourself to talk. Save your energy. Close your eyes if it helps you relax and concentrate only on breathing steadily. Each calm breath helps your body cope better with the emergency. Stress hormones released during fear can narrow blood vessels and worsen the stroke's effects. By staying calm, you help keep blood vessels more relaxed and improve blood flow to the brain. This does not cure a stroke, but it can slow damage until medical treatment begins. If your heart feels like it is racing, slow breathing can help bring it under control. Count silently. Inhale for 4 seconds, pause briefly, then exhale for 4 seconds. Repeat this pattern as long as you can. If you feel nauseous, turn your head slightly to the side while continuing slow breathing. Remember, you are not powerless in this moment. Even small actions matter. Staying calm and breathing slowly is something you can control, even when other functions fail. This simple act can protect your brain, prevent complications, and help you survive until professional help arrives. 7. Prepare before a stroke happens. Preparing before a stroke ever happens is one of the most powerful steps a senior can take to protect their life. A stroke often strikes without warning, and in those critical moments, preparation can mean the difference between quick treatment and dangerous delay. Many seniors believe preparation is unnecessary or frightening, but in reality, it brings peace of mind and control. Start by keeping emergency numbers saved on speed dial on your phone. Make sure you can access them with one touch, even if your hands feel weak or shaky. If you use a landline, keep a written list of emergency numbers placed near the phone in large, clear writing. Time lost searching for numbers can be life-threatening. During a stroke, wearing a medical alert bracelet or necklace is another simple but life-saving habit. These alerts can inform emergency responders about your age, medical conditions, medications, or allergies if you are unable to speak. In some cases, medical alert devices can automatically call for help with the press of a button or even detect falls. It is also important to inform trusted neighbors, friends, or nearby family members about your health risks. Let them know what to do if they notice warning signs or if you call them in distress. Even a quick knock on the door from a neighbor can save valuable time. Keep your home easy to access. Avoid complicated locks. Keep walkways clear and ensure doors can be opened quickly. Store important medical information such as medications and past illnesses in one visible place for responders. Finally, educate yourself regularly about stroke warning signs and healthy habits. Preparation is not fear, it is strength. By planning ahead, you give yourself the best possible chance to survive a stroke and recover with dignity and independence.